Okay, so part two, I really can't say enough about making sure you do your research. You are in control of your own health. There's going to be lots of different opinions. You cannot rely on another person to fully make these decisions for you. It's not an excuse. You got to do your own research, and that'll just make you more informed. It'll help you know what questions to ask. And if you come across someone trying to sell you a surgery that just isn't going to work or has a low yield or low percentage of working, then you can just move on to the next person. And I also think it is imperative for you to try everything else unless you are clearly having such bad radiculopathy that it's leading to bowel bladder problems, extreme weakness, or you're having major problems performing your job to the highest ability. Obviously, this is just an opinion on reasons why you should have back surgery. For myself, I probably could have gone on performing my job at maybe 90 to 95%, but I just felt like it was getting worse, and I want to give 100% at my job. And I also had our first, well, I didn't have it, my wife had our first child about 3.5 months before, or 3 months before this surgery, and I didn't want to get to the point where I couldn't pick her up or play with her, and that was rapidly approaching. I can't, for the most part, even get on the floor with her. And the other reason for me is, it's just very difficult for me to sleep since I can't lay on my back. I lay on my sides, and I go through pretty decent aches and pains in my shoulders and hips because it's the only place I can lay on to sleep. But anyway, I think it's of the utmost importance that you don't rely on going to a surgeon as step one unless there are very clear indications, because for the vast majority of people, this is going to get better with physical therapy, and time is the biggest factor. It'll get better with time. So just to kind of move onward, I had a meeting with my surgeon, and I knew that this guy was probably the right guy for me. After the first visit, I also, because it was in the L5S1 area, looked into some experimental stem cell injections and really didn't qualify for any of those. You can look up NIH or NCBI and see kind of what studies are in your area. I got a hold of some people in Europe and looked into disc replacement, and ultimately, because I have a little bit of retrolisthesis and because it's at the L5S1 area, I thought that probably wouldn't be the best idea. And furthermore, with greater than 50% disc loss, many of the initial studies didn't enroll people with severe disc height loss. But I did have at least 2 people who shot back emails to me and said it looked like a possibility. So again, people are willing to sell you a surgery, and you got to be really careful about that. When I met with my current surgeon who ended up doing this surgery for me, I asked him about that, and he said the exact same things. You're not a candidate. We worry about doing lumbar fusions, of course, because that can lead to adjacent segment breakdown and disease, which can ultimately lead to pain, instability, and sometimes the need for another procedure. So I've done a lot of research, and the numbers out there, they don't look great. Up to 30% of people in some of the studies I looked at had symptomatic adjacent segment disease, and up to 5 to 10% of people required surgery, repeat surgery. However, those studies just, they don't break people down by, number one, what the condition is that you're having surgery for, and they often don't do a great job at separating people out into groups so they can be individually studied. In essence, there's just not enough research about it. So it's very difficult to kind of interpret and go forth with that decision. But in my case, L5S1, there seems to be some literature that adjacent segment disease may be less after that fusion. But the biggest things, if you look at studies, is the rest of your discs have to be healthy when you get that first fusion. For you to be at the best chance, you have to have a surgeon who puts your back into lordosis, back into normal lordosis, which is the original curve in your spine. And then there's a lot of other things, like for it to be successful, it really helps to have a job and a life that you want to really get back to, because those are going to be the biggest healing factors. And of course, it helps to have a fantastic positive attitude, which is, that's what I struggle with the most. Anyway, you need to look that up yourself. Again, this is just advice. I am an amateur when it comes to looking up information in that field. So please don't take that as, the gold standard or written in stone. But you should know your risk factors and your factors that may make it more likely that this will be successful. And you should know that before you go in for your first visit. Anyway, I had 3 different great surgeons suggest 3 different approaches. One was actually, I'm going to make this into 3 videos, and sorry, it's really long. We'll talk about the 3 different approaches.